Hello everyone, thank you for joining us today on our webinar, How to Get a Medicare PTAN and Revalidation. There's no audio or videotaping allowed, and any unauthorized reproduction, dispensing, or reproducing, forwarding, or copying of this target coding presentation is illegal. My name is Natasha Wirz. I'm the Executive Director here at Target Coding. I'm also the Director of our HIPAA Compliance Services, Credentialing Advisor to nationwide providers, Seminar Event Coordinator, expert in staff training to thousands of CAs. I've also been a chiropractic assistant, office manager, and licensed massage therapist. I'd like to tell you a little bit about Dr. Marty Kotlar. He is the President of Target Coding. He's a Certified Professional Compliance Officer, Certified Billing and Coding Specialist, CPT, ICD-10, HCPCS coding, Medicare, and HIPAA compliance expert. He's also an author of 10 compliance and documentation training manuals, contributing writer to numerous publications and journals, and guest speaker at many state association conferences. All right, so today we're going to be talking about PTANs and revalidation. So first, what is a PTAN? A PTAN is a Medicare-only number issued to providers by Medicare Administrative Contractors, or MACs, upon enrollment to Medicare. MACs issue an approval or notification letter including PTAN information when an enrollment is approved. So what's a MAC? A MAC is a Medicare Administrative Contractor, is a private healthcare insurer that has been awarded a geographical jurisdiction to process Medicare Part A and Part B medical claims. So what's really the difference between having a PTAN and an NPI? Well, according to CMS, the NPI is different from a PTAN in the following ways. A provider's NPI is issued by the National Plan and Provider Enumerator System, which is NPPES, which was developed by CMS to comply with the HIPAA administrative simplification provisions for standard transactions. It is used by all health plans and health clearinghouses when submitting HIPAA standard transactions, like medical claims. A PTAN is specific to Medicare and is issued to providers upon enrollment in Medicare. So if you are participating in Medicare, a provider will need both an NPI and a PTAN. A couple little things you'll also need to know about PTAN is a provider can only have one NPI number, but may have multiple PTAN numbers representing enrollment through multiple practices or multiple Medicare contractors. So if you move from one state, you might have had a PTAN in that state, and then you move to another state, you'll have a different PTAN for the other state, or if you practice in multiple states. A PTAN is necessary for authenticating the provider when contacting the MAC for information. Also, PTAN can be found by viewing the letter sent by the MAC approving the provider's Medicare enrollment, or by logging into the internet-based provider enrollment chain and ownership system, which is PECOS. Well, where do we start? First, we'd want to log into NPPES, the National Plan and Provider Enumerator System. You should have gotten a username and password when you received your NPI number. If you've never done this before or you're a new doctor, you're going to want to go ahead to create a new account section and go ahead and get yourself an NPI number. If you're going to be practicing as an individual and also have an organization, you'll have to apply for a Type 1 and a Type 2 NPI. Once you've logged in and registered yourself, you will find that the Type 1 is for an individual NPI number and a Type 2 is for an organization. You will see in the Type section an icon of a provider that is for an individual or a Type 1. It will normally have your name, your primary practice location, and the NPI number that's been assigned to you, plus your primary taxonomy, which is your specialty. Then you will find, if you have your group or your organization, which is your Type 2, there'll be an icon of a building with the tax ID, the legal business name, the practice location, and also the NPI number that was assigned to it. Second, you're going to want to go in, once you have all your information up to date in NPPES, you're going to want to make sure you go into the INA system. This is the Identity and Access Management System. This system speaks with PECOS and NPPES, so you want to make sure all the information in this system is correct and what NPPES has sent them has been updated in INA. INA will house information about you as the provider, personal information, as well as information about organization and other status. You'll also find tabs with information to add staff members who can be assigned certain roles to be able to change information within your application. If you ever forget your password to NPPES or INA or PECOS, you can come into INA and click the Retrieve Forgotten User ID, and it will normally go through a series of security questions if you happen to know what those are. A lot of times people forget what they assign themselves as their security questions, or a staff member set up this account and they don't know the answer. If you get into PECOS and you get into this login section after you've checked everything in INA, remember that the system does only allow you to make 3 attempts to log in. So if you've forgotten your password, you definitely want to go back to INA and either attempt the user retrieval options or contact EUS for assistance, because after 3 attempts, you will be locked out. Also, just a reminder, some things have changed. So in the systems notification section, when you log into the PECOS section, before logging in, you'll always see systems notification. Right now, you will find a notification reminding PECOS users that no longer are they accepting mailed documents that require signature. You can either opt for the e-signature option or upload the signatures documents right into the system. If you've never used this, you can register yourself, but remember that you need an INA account to even get into this, to start the PECOS process, and you need an NPI number. If for some reason you believe at some point someone started an NPI account for you and you have a username and password for the NPI system for NPPES, but you don't know what it is, you can contact PECOS External User Services for assistance. Your username will always be the same. It will stay with you for life, just like your NPI number does, but the passwords do regenerate every 60 days. So if you are not in the system often, you will be having to reset your password. If for some reason you're still locked out of your account, EUS can help you gain a temporary password to get in. If staff are assisting in this, I suggest you get the provider on the line to get this, because they will not speak to staff if you are not an authorized user to begin with. There's also helpful links within the PECOS system. So before you log in, underneath the login section, there's enrollment tutorials. These enrollment tutorials are broken up into the different types of applications that are available, and also the tutorials are segmented by an individual provider or an organization. So depending on the application that you are trying to submit, these are good videos to watch to get you familiar with the system and what you'll need. Once you log into PECOS, you'll be prompted to a section like this, which will allow you to choose what you want to do. So the My Associate section for a new enrollment is where we're going to go. That's where Medicare enrollments are processed and where you would need to start your whole process to get your enrollment going. The Account Management tab will take you back to INA, and that's where all the management of these accounts are held. Before you start your enrollment, you want to remember a couple of things. If this is an initial enrollment, you got to remember that the only time you start an initial enrollment, if it's your first time applying to Medicare, if you're enrolling in a new state, or if you have changed your specialty. On this page, you will also find some helpful links and how-to guides. So if you're still confused and you need assistance, there are guides on how to navigate through the system and other information on printing, etc. You can also download checklists depending on the type of application that you're doing. I suggest that you do this so you obtain all the information you need before you start the enrollment process. It can be very lengthy if you don't have all the information that they're going to be asking you readily available. Now that you have everything on your checklist, you can go ahead and create the initial enrollment application. Once you get into the initial enrollment section, this is just the beginning part. You're just answering information so the application can get generated for you to start. You're going to get into an application questionnaire section. The first question that's going to be prompted is if you are the appropriate provider. So your name should show up if you're filling out an application for yourself as the provider. If the application is for an organization, the legal business name should show up, and you should make sure that it looks correct. If anything is incorrect, this means NPPES or INA has incorrect information in their systems. You'll be prompted through other questions, and then it will take you through the application description. It will need to know what kind of application you're going to be submitting. So in this case, you need to select the setting in which you work. So if you're a sole owner and this is, you own your own business or corporation, you're going to be picking the first option. If you are a group practice member, which means you're an individual provider, but you're working within the practice and you're going to be reassigning your benefits to the practice that you work for, you're a group member only. You're going to be prompted through several questions within the application questionnaire for them to gain information about the provider or the group practice. In this sample, we're talking about an individual provider, so it will indicate the provider's name. Social security number will be not visible, but will auto-generate from the information that's been put into NPPES, as well as the date of birth. Once that auto-generates, you'll go on to the next section and a series of questions will come up. What state or territory is this application for? It will ask you date of birth information as to the state, the country and state of birth, also what medical school and when did you graduate, and some other identifying information. Once you fill out all those sections, it will prompt you to the actual Medicare enrollment. When you get to this portion, it will allow you to actually start the application process. You will be taken to a window like this that will have the application ready to go and to fill out. At this point, you'll be given an enrollment ID, a PACE ID, and a web tracking ID. These IDs will help you later on when you need to check on your application with your MAC carrier. You'll also see 3 tabs at the top: a topic view, a fast track, and an error warning check. Within the error warning check tab, if something is wrong, you will see a red box with a number. Also, if something is not filled out or was skipped, you will see that as well. Right now, you're seeing a topic view. This is where I like to start with any new application. Fast track is okay to use if you've already filled out an application in the past and you're just going in quickly to change a certain area. But if it's your first time, I suggest staying within topic view, starting with personal information and working your way through the entire application from start to finish and just going on to each topic. Once you've completed all the topics, you should have a check mark next to every section, and you can go ahead and begin submission. Some people notice that at the top of the application, it doesn't have a full 100%. It'll normally show 90% at this point because you have not finished all the sections for signing and electronic signature and some other required attestations that you need to do. So once everything is filled out, you've uploaded any supporting documentation, anything that they've required from you as you've gone through the process, you can go ahead now and click Begin Submission. You'll get to the e-signature system section. You'll go ahead and attest to any terms and accept those terms and conditions for those sections and go ahead and finish the e-signature portion. Now that you've finished that, You'll get a pop-up window that normally pops up that gives you some important information to remember. Once you close that down, it will allow you to print this submission confirmation. It will show that you've completed your submission. You'll also be advised that within 15 days of submitting electronically, Medicare can contact you with additional information that they might need. If you do not respond to their requests within the time allotted, they will just throw your application away and you will be starting over. So the 15 days is really crucial. Mark your calendar, be checking on it, make sure that they are not sending you emails or sending other communications to you. I've had them call offices, send emails. If they need something, they will try and reach out to you. So make sure that you are able to communicate with them. Once you've completed your application, you will see when you log back into My Associates that now you'll have two sections, either an individual or an organization, or both if you've done two separate submissions. If you're an individual, you'll have your provider name and NPI, and you can click on the View Enrollment section. Once you get there, it will show you the contractor that your MAC carrier that you're assigned to. So in this case, it's Florida, so it's First Coast Service Options. It's going to show your specialty. It's going to show the enrollment type or your application type. In this case, it's an 855I. You're going to see that it's awaiting processing, and you can actually click to view the actual application. Also, you'll have a tracking number, and if you have any assignments, if you've reassigned your benefits to a practice or organization, it will show that for you as well. An 855B, this is your organizational enrollment type. It's very similar to an individual. You'll also see the contractor, the state. Here, the specialty is going to be clinic or group practice. You'll also see that the status is awaiting processing. You'll have your location address, and it's only going to generate, if you have multiple addresses for this practice, it's only going to generate the first location. You would have to actually be within the application to see the other locations. You'll have a tracking number and any pending reassignments that need to be viewed. So congratulations, you've completed your first Medicare provider enrollment. So now some of you that you have your enrollment, you've been with Medicare for some time, normally within a 3-year time frame, they're going to contact you to revalidate your application. Make sure that all the information is correct. So just like when you applied, you're going to go to either the My Associates section or the Revalidation Notification Center. You can go to the Notification Center to check to see if you need to do anything for revalidation, or if you had started an application, you need to continue it, you had to come back to it. But you can also go into the My Associates section and check if there's anything in there for you. Once you log in, you'll see your existing enrollment, and in this case, if you're an individual, you will see your enrollment here. It'll have all the information just like when you originally applied, but instead of the status being awaiting approval, at this point, your status is approved. You'll see a revalidation notice date. That's the date that the notice was sent to you. You'll normally receive a yellow envelope in the mail. They're bright yellow to indicate that it's something that you need to pay attention to, but you can always check by logging in. At this point, when you see that you've received a notice, you can go ahead, it's normally about 6 months ahead of the due date, so you can go ahead and click on the revalidation button. It will take you to the confirmation reason for application section. This is just to confirm that you're only doing a revalidation, and you're going to go ahead and update any information at this time, and you can go ahead and start the application. Once you go in, it's going to take you right to a very similar page as to when you originally enrolled. You're going to go through all the topics, make sure all the information are correct. You're probably going to see check marks. You might even see an error warning, maybe 1 or 2, where Medicare is indicating that things have changed since you originally applied maybe 3 years ago, and they need some additional information for those sections. Sometimes these systems are updated, so questions that they asked you 3 years ago might have not been asked when it's time to revalidate. You want to make sure that everything in here is correct. If anything has changed, you make sure that you updated it in NPPES, like an address change or something like that. And if you've changed anything with electronic funds transfers or banks that you use or contact person, you want to update all of that. Double check everything is correct. If something needs to be changed, you'll go to that topic, do an edit or a deletion, confirm it, and go on to the next topic. Also, when you've uploaded documents in the past, if it's time to update a document, this is the time to go ahead and edit the document and re-upload any new documentation you have. If not, you can leave alone this section and move on to completing your application. At this point, if you don't have any error check warnings, you can go ahead and begin the transmission of your application. So, congratulations, you've just completed a revalidation. Just like with your initial application, you'll also be able to download a confirmation, and the process is the same. If additional information is needed, they will contact you within that 15-day time frame. Okay, so a lot of you might still have questions or not sure, or something comes up in the process of you filling out your application, or you might have special circumstances and you want to find out more. You can visit this website on CMS through PECOS, which is their Help Frequently Asked Questions section. This will allow you to get this information that you need. If you find that there's not a question here that, is not answered, or you're not sure about, because chiropractic sometimes does have some special circumstances, or you're setting up a physical therapist, and since they're a non-physician, it's just slightly different. You can always contact us here at Target Coding. We're happy to help. Also, I've uploaded a handout. If you're on this webinar live today, you can go ahead and download this handout right now. It's in your control panel. It allows you to obtain the handout. This is a PECOS technical assistant form. It's got a lot of useful information and links to help you when troubleshooting common problems and who to contact within Medicare or PECOS. I know it's very confusing when you're dealing with Medicare. You have PECOS and CMS, and then you also have your MAC carriers. So sometimes people don't know who to reach out to or what to do in these situations. So this form is targeted especially to PECOS and any technical assistance you need. Obviously, most of the time your solution is going to be to contact CMS's EUS help desk. They primarily are the ones that help with most of these issues. Also, you might have some additional problems like assessing the PECOS system or non-technical issues. These are all links that are active within the document that will allow you to go to that section, and they'll help walk you through any issues you might be having with maybe the actual enrollment or other issues that might arise. There's also a resource chart that has active links that will take you to where you need to go, like let's say the National Provider Identification Standards, or you need to get back to PECOS, or you need to get to External User Services, the Frequently Asked Questions link. All of these are within here. There's a reference guide and tons of other information that you can utilize. Thank you for attending our webinar. We enjoy having you. Just a couple closing comments. Do remember that when you are dealing with a carrier, that you check with them prior to submitting any information, claims, revalidations, to make sure that the information you're providing them is what they require. We do our best during our presentations to ensure that the information is up to date and compliant, but things do change. So it is your responsibility to do your due diligence and just make sure that when you're dealing with a specific carrier, that you're giving them the items that they need in order to assist you. Just a reminder, Target Coding offers a wide range of products and services. We do help chiropractic offices and multi-specialty offices We have products like videos, training manuals, guidebooks, forms, staff training tools. We also offer a range of services that help with audit prevention, on-site training, one-on-one consulting. We do hourly services. We also offer compliance services like HIPAA compliance, Medicare compliance programs, billing and coding manuals. We do offer a range of membership services that are designed to help every practice. So if you're looking for assistance and you want to be able to just have someone in your back pocket at all times, we have a range of memberships that can help you. We also offer seminars and webinars. Most of our webinars and seminars are approved for CE credits in over 30 states. We also have live seminars all over the United States, as well as webinars pretty much once a week on a Thursday. We offer this amazing forms pack. It has tons of forms that can help you. They're all customizable. What I love about them is not only are they in a Microsoft Word format and customizable, but there's a range of them, especially like the letters of medical necessity and the appeals letter are great for staff, and the financial and administrative forms. I love all of those. I know a lot of doctors that I talk to really love like our SOAP note templates and our exam templates. So if it's something that you're looking for to get good, new, clean forms, this is a great product. It also includes our HIPAA forms, and you're gonna really love those because every office needs really good HIPAA forms, and these are great to have. So it's another little bonus that's added into this forms pack. Everyone who listens to these webinars knows that I always rave about our guidebook. It's my favorite product of all time that we've had. It's always being updated as times have changed, but it's my go-to. I love it. One of the things I truly have always loved about it is that Dr. Kotlar not only provides you with an easy way to link your codes, your diagnosis codes with your CPT codes, and really helps you understand the process and the clinical rationale and what fits with what and that pairing. But my favorite thing is our quick reference guides. It's really truly my favorite thing. I used to use it a lot in our office when I needed my doctor to give me a new diagnosis code for a new patient or for a re-exam. It was a quick, easy way for them to just check off what was necessary, what the updates were, and hand it over to me. Once I got this book, I didn't have to, track down my doctor at 7 o'clock at night for diagnosis codes. So that's why I think I love it so much as well. Do you SWAN? Do you sleep well at night? It's one of our favorite acronyms here at Target Coding. I think this is a great program because one of the top questions I get asked here is, am I doing things right? Well, how do you know if you're doing things right if you haven't had someone check in on you? So this is a great way to do that. Our Smart Choice program is like having someone come in, give you a mini audit, give you a report of findings, lead you through the process of what you're doing right and where you might need to make some changes. And it's just a great self-check. I think every office should do this. It's just a wonderful way to really know for sure where you need to make changes. Every office should be having some type of policy manual. We just learned about Medicare and enrolling into Medicare, so having an OIG Medicare manual is required once you become enrolled with Medicare. If you do not have one, you definitely need to put one in place. But even if you're not with Medicare, you should have some type of billing and coding manual in place. We also offer HIPAA compliance services. It's one of the things that I'm very passionate about. I love HIPAA. I know I'm a little bit of a HIPAA nerd when it comes to that, but I've put together this program for you guys because I am a staff person. I do know the struggles of being in a chiropractic office and how hard it is to find the time to do all of these things that HIPAA requires. So we've designed our HIPAA concierge compliance service so that we are truly holding your hand through the whole process. We are here to help you. We do a comprehensive review. I put a whole work plan together for you. There's training modules in here for your staff to make it simple. I have a lot of tracking techniques. All your policies are created for you, so you don't need to guess about those 18 policies and procedures you're supposed to have. I help you mirror those policies with any documents that you need to put in place, or logs, or audit forms. So I truly help you connect all the dots. And especially since the administrative section of HIPAA is one of the biggest portions of your HIPAA compliancy, it's really important to get that done within the first year that you're working on HIPAA if it's your first time. Also, the great part about this that I'm so excited is we've also included our OIG Medicare compliance manual in with our HIPAA program. So you really get both compliance programs in one, and it's a great opportunity. So if you're interested or you need more help with your compliance, please contact us. I'm happy to help you. Also, I want to remind you that we do have seminars and webinars all over with CE credits. If you want to stay up to date and you want to know when we're going to be someplace, please join our newsletter list. But also, our newsletters are not just about where we're going to be or what specials we're having. I know that's amazing information, but we have tons of content that we send to you with hot topics, what's going on, what you need to be aware of. So it's important for you to definitely join our list so that you're up to date on what's happening around you. Thank you again for attending our webinar, and you have a wonderful day. The best compliment you can give us is a referral. So if you enjoy these webinars, please tell your friends, your colleagues. If you enjoy our services, tell everybody about us. We really appreciate those referrals. It really is the biggest compliment to us, and we thank you. If you need to contact me and you have some additional questions, feel free to email me at natasha@targetcoding.com. You can also visit our website for more information on what we do. You can give us a call at 1-800-270-7044. We're on all social media platforms, so feel free to contact us on Facebook, on Instagram. Also, you can catch up on any videos you've missed on YouTube. We're also on Twitter. Thanks again for attending. We hope to see you soon.